So here's my neck. As you can tell, it's hurting me. Oh, look at my fucking neck, bitch.
I think you look
Snatched and popping?
Snatched and popping.
Oh.
Hi everyone, Dr. Gary Linkov here of City Facial Plastics in New York City. Don't forget to like, comment, and subscribe to the channel if you like what we're doing here. So today, I'm gonna be doing a reaction video on Jenna Marbles' video called Giving Myself a Tape Facelift. I do facelifts and I'm kind of curious to see what this is all about. Here we go.
Hi, welcome back. Today it was a little bit of a rainy day. Good thing I got rainy day activity. I was watching a video of a pretty well-known makeup artist. Her name is Rouge. She does a lot of work with the Kardashians, I feel like. Hi, honey. I saw that she posted a video about...
So just an aside, she's got an Italian Greyhound there, and I always wanted to get an Italian Greyhound, but my wife wanted a wiener dog, and guess what? We ended up with a wiener dog. But there's always a special place in my heart for Italian Greyhounds.
Face tape to do an instant facelift. Julian, would you like a rainy day facelift?
No.
Why not? I feel like I knew what this was. This is the kit that I got. This is the one that Rouge recommended.
You know, people are always talking about these instant facelifts, whether it's surgical or non-surgical. You know, it's just interesting to see that even in like the makeup world, they have their version of a facelift. So you have it in the injectable world, people who are doing a lot of like filler, you know, they call it like a liquid facelift, and then you have different types of surgical facelifts, and everyone kind of thinks that, you know, their facelift is the most effective, the best thing ever. So we'll see what the tape facelift looks like.
It's basically face tape that you use to pull your face up. As far as I knew, I thought that this was like an old stage trick that people like used on Broadway, you know? It's like the only person I've ever really seen with face tape that I'm aware of is like Cher.
Cher from Stuck on You?
Cher from Stuck on You, yes. I just wanted to play with it because she made a video and it looked super easy. And as someone that doesn't have any Botox or fillers because I'm afraid of needles, but more power to you for whatever you do to your own body and your own face, whatever makes you happy, you live your life. I want to tape my face up because I want to see what it would look like. You know, if I was like, had a nice event to go to that I never go to.
You don't go to events.
I don't know what's something else that I would go to.
Party.
A party?
You don't go to parties.
If I went to a party.
You don't go to parties.
I bet with 20 million subscribers, she definitely gets invited to parties, even if she chooses not to go.
She was saying that she used it because she had some swelling or something and was self-conscious and that it was really helpful to her. And I just think that that's really cool. And she promised me in this video that I would look snatched and poppin'.
I'm gonna show you guys how I snatch myself from top to bottom.
What did she just say?
How she snatches herself from top to bottom.
If this could help you or make you feel more comfortable, not everyone has Botox or fillers.
That's me.
This definitely your whole face.
Well, I did a video on do-it-yourself filler and got a lot of slack for it from the do-it-yourself community on that video. You know, I think something like tape facelift, we'll see what exactly that is, but I sort of have an idea. I think this is something that everyone can do at home. I think it's overall very safe. I mean, we'll see how they secure it and all of that, but filler, doing that at home is not safe. So no matter what the do-it-yourself community says, I'm going to continue to put out, you know, sound medical knowledge out there. That's just my commentary on that video.
Now, I'm sure some of you have seen this here and there.
On Cher from Suck on You.
You guys really know how to do it correctly without You will need a bare face while doing this. Little tapes will not stick onto makeup. The reason why I have nothing on.
Yeah, and even when I'm putting on surgical tape on the face, if there's any kind of like oil on the skin, or sometimes even like some betadine, which is what we use to clean the face, well, before surgery, but even if after some remains, the tape won't stick on, like if I'm putting a dressing on the face. So it's a good point here. You know, in general, you want to clean your face if you're going to put any kind of tape on there so that it actually sticks.
You can't use these if your hair is going to be up. because then you would have to like put it on top of your baby hairs, and I don't suggest it because it rips off. It's not worth a bald spot.
Yeah, so if you have tape that is on an area of hair that especially has like finer hairs, you definitely run the risk of having some degree of alopecia from it, because as you guys know, I'm a hair restoration surgeon as well, and that is a concern. There are conditions where people will put their hair into very tight styles, or if you continuously use, I think, this tape for taping up your face, you also run the risk of developing some alopecia or hair loss in those areas. So I think from that standpoint, you have to be careful.
I like it where like my eyebrows look a little straighter. You should put them like right there.
This whole thing says that it's created by Emmy award-winning makeup artist Art Harding. But I feel like if you were to do this like on a regular basis, like all the time, every day,
Wait, show me your...
wouldn't it sort of like stretch your skin out? You know what I mean?
If you do it all the time, every day, you run the risk of potentially stretching out the skin. As you know, as we all age, the skin elongates over time anyway. So could you accelerate the aging process by using this tape all the time? Potentially, but I don't think that there are people who are using this tape all the time. It seems like it's maybe just done for special events and things like that, in which case it's a pretty short period of time. The only thing that you're going to really be bothered by is just some potential irritation on the skin, but you're unlikely to cause any long-term problems by using it every once in a while. But I think Jenna makes a good point that if you're constantly stretching out your skin in this very tight fashion, not only could you potentially do damage to hair, but also the skin of the face itself and the neck could potentially stretch out faster over time. Ad. Can't even skip this ad. You just have to deal with it.
So the first thing is to pull up your hair. Ouch. I have these little crocodile clips. I'm gonna look like
I gotta pull up my hair.
name's Olga. Put the metal piece inside the tape. There are 4 notches on this, and it depends on how tight you want to go. Tightness, I mean how I like to place it super close
Okay.
to
So
my
I think you just
eyebrow.
So just in terms of like semantics, let's talk about that, because it looks like the makeup girl and Jenna are going to be just working on the eyebrows. A lot of times people come in and they ask me for, facelift, but they're also looking to address the lateral eyebrows, and that's considered a brow lift. That's not really within the realm of standard facelift. When we talk about facelifts, we're usually referring to the lower face and the neck. In kind of today's day and age, the most modern type of facelift is a deep plane facelift, which is what I've started doing. And those facelifts also address the mid-face. But if you're looking to get the eyebrows elevated, at least with surgery, then you're looking into brow lifting, which is a little different. So what they're working on here looks to me like more like a brow lift, even though they've called it a facelift.
And it's gonna go under my tape extension.
So there's this kind of more recent fad of elevating the lateral brow, especially in younger patients, over time, which is an interesting thing, because what we're learning as a community of plastic surgeons, especially in aesthetics, is that the lateral brow, this portion out here, the tail, tends to descend more than the medial brow. So back in the day, brow lifts used to be done across the entire forehead, and it left people looking very surprised and kind of unnatural. And as we kind of learned more, we found out that there's more of a drop on the sides than in the middle. And so a lot of our surgeries now address the side dropping rather than the middle. But this is something that occurs over time, meaning that, as people age, like into their 50s, 60s, you start to see this descend. But younger people have a very natural looking brow where there's a natural arch, the head of the brow and the tail of the brow are kind of on the same level, and yet they still want that extra kind of accentuated sweep upwards, and that's why they're looking into things like this, which is the tape method. And there's also some Botox you can occasionally do to help that process. There's filler, and then thread lifting. Those are the main kind of non-surgical entities to try to get the lateral brow elevated. So this is yet another option for people looking for that sort of fox eye look, if you will. That's sort of a fad right now.
she taped her brow with the tape that she put under her tape.
Just to point out here, if you're looking at anyone, anytime I assess a face, especially before surgery, I'm looking for asymmetries. People like to think that sometimes their face is exactly the same, or they happen to see one little difference and they're shocked by that. But all of our faces are asymmetrical. And so if you look at Jenna Marbles' face, the right eyebrow is higher than the left. And even when I trained, I was taught that it's just a difference of the brow height. But oftentimes it's that the whole eye socket is kind of displaced a little bit higher than the other. And that's normal. We all have some variety of that. So in her case, just to point out, the right eyebrow is a bit at a higher level than the left. So when you're looking to put on this tape, or if you're looking to have surgery, it's important to try to bring things into some degree of symmetry, but it's never going to be perfectly symmetrical.
So she said super close to the brow, and then like that. Oh!
The metal piece gives it away.
Oh, hers is under. I messed up. Oh, wait, that is so fun.
Pulled back.
Yes,
That's
bitch.
I think in this view, the makeup artist, she has a bit more of a natural arch to her brow, and so when she does the elevation, it still kind of has some character to it. I think when Jenna does it, her eyebrow is very flat, a little bit unnaturally so, and so when she does the elevation, it really has a very unnatural appearance to it. It looks okay at rest, but with this taping, I don't think that it complements her.
To the other side. Make sure you have clean hands for this too, obviously. Just hold them down a little bit.
Really close to my brow.
Do you want me to try to tie them together?
No, I'll do it. Oh! Wait, what? Wait. Does that look natural?
Yeah, I paused it here at 6:57. I don't think it looks natural at all. The brows are way too high. They're way too horizontal. There's no shape to them. So I think this tape job is not working for Jenna. But for some people it might be helpful. I don't know how long the tape stays sticky for and how long it'll last, but it seems to kind of be holding up. But I would imagine that it also, you feel probably kind of like a strain, and I don't think that just relaxes. I think you just continuously feel that strain on the eyes, which might be unpleasant.
Wait, like fucking really hurts.
It hurts?
See, she said it
It's
hurts.
like my face is getting pulled apart.
Yeah, it is.
Imagine being at a
God,
social
that's
function
insane.
looking
I
like
mean, you
that.
look good, but, like,
Not
what
pleasant.
insane.
You still have like upward mobility with your eyebrows.
Blink. Okay. Wink. That's hot.
This is a lot easier to use than I thought it would be. I thought this was gonna be kind of difficult, but the tape is so sticky that it just like goes on.
The nice thing is, it looks like with enough makeup and with your hair down, you can kind of cover up signs of having the tape there.
Like that doesn't look right. I feel like that doesn't look right.
Like, you look beautiful, but that just might be you looking beautiful.
It's been displaced so high up that what she's referring to is that you lose that supratarsal crease, which is the crease of the upper eyelid, because of how much the eyelid skin has been displaced up. So that's what she's getting at when she says that the upper eyelid doesn't look right.
Now that time is like going by a little, it's starting to dissipate. Like I can't feel it as much anymore, but like right where the tape is really hurts.
Can you think?
No, I'm having a hard time thinking.
The dog is crying in the background.
I feel like that makes it worse, doesn't it?
Yeah.
Like you need a really specific hairstyle to make this work.
Yeah, I mean, even after she put a little makeup there on the side, I can still see signs of that tape. So I don't know how you can completely hide it unless you have hair coming over it in the front.
This is pretty sick.
It's kind of dope.
I like how flat it makes my eyebrows, because everyone always makes fun of my eyebrows, but like, what if they looked like this? Would you guys stop making fun of me?
I wasn't really making fun of her before about the eyebrows. I was just pointing out how her eyebrows compare to other people's.
It holds really well. Like I don't feel it slipping or anything like that. I want to try the neck one. Hey girl. Ah, good girl.
She has another Italian Greyhound in the background. At 9:30, I can see him back there. That's amazing.
Oh my God.
What happened?
I I cut myself on my beautiful making thing.
Oh my gosh, now she had an accident. She cut her finger, I think it was.
I'm putting a band-aid on my...
Oh man, see, so this tape stuff can be dangerous too.
This is really fun. I feel like I've done worse things to my face, have I not?
You 100% have.
Do one side and then squeeze my neck together. Oh, look at my fucking neck, bitch. Oh, so here's my neck tape. As you can tell, it's hurting me. How's my neck look?
Your neck looks sick.
So remember what I said before with the facelift, we always address the neck as well. That kind of comes along with it since it's really one continuous structure underneath the skin. And so yeah, I guess this tape can be used on the neck as well. And you know, some people, that's all that bothers them. It's really the neck area. So hey, you know, for an easy fix for one night out, maybe tape is the way to go.
It's kind of awesome. It feels like someone is just pinching the back of my neck like this. What do you think?
I think you look
Snatched and
snatched
popping?
and popping, but your neck looks identical. I mean, I don't think you needed the neck lift.
The neck is very
Snatched and
uncomfortable.
I can imagine it feels like someone's slowly choking you.
Yeah, it feels very choky. I think it feels kind of good.
The choky feeling?
No, the brow one.
Oh, yeah. No,
Like
it
the
looks-
pain has gone away completely. My
It's
face
just
has
like
gotten
gotten
used to it.
yeah.
Yeah.
So she's gotten used to it, which is good. I didn't think it was going to be that quick for her to kind of accommodate to the tape. That's good. That's promising.
Wait, I feel like when I laugh, it gives it away because you can see my face like.
Just don't emote.
So I think the advantages of the tape are that it's likely very cheap. I don't know how much this stuff costs, but it can't be very much. So it's relatively cheap, especially compared to the injectables and surgery. It seems pretty easy to put on. I think overall it's safe, other than maybe using it all the time and the effect that it could have, like we said before, in stretching out the skin or causing some areas of hair loss. Overall, like not a bad thing to consider for like a quick improvement with skin laxity. But the disadvantages are that it's very, very temporary. Obviously, removing it, you're going to lose that effect right away. It can potentially kind of hurt a little bit. It seemed like she was kind of uncomfortable and has different little metal parts, and those are some of, I think, the disadvantages. It could potentially be pretty visible as well. So some people are worried that, you know, others might see that and think that they're just, you know, doing something kind of fake or whatnot. It's definitely an option for some folks, and I didn't really know too much about tape facelifting before, so it's been educational for me as well. And remember, just to kind of separate out the terms a little bit, this can be used, it seems like, for brow lifting and also for at least neck lifting. Potentially you can put the tape on the sides here as well to lift. I would imagine it could be a little bit more visible there. So at least what they've demonstrated in this video are brow lifting and neck lifting. That's good to know. So once again, Dr. Gary Linkov. I'm a facial plastic surgeon and hair restoration surgeon in New York City. If you liked the video, please like, comment, and subscribe to the channel. And let me know what else you want to have me react to. Thanks, guys.